Hello and welcome to Wellness Wednesday. I'm James Currie with the Communications Department, and we're talking about mental health awareness. And I'll let my guests introduce themselves and say what department they work in here at MCHD. So go right ahead.
Thanks for having us. My name is Skandan Ananthasekar, and I am with the Health Equity Office, and I am one of the outreach educators with the HEO. What I do is attend events in the community and provide resources and education for any members of our community.
Thank you for having me. My name is Reba Pendleton. I am the Director of Social Services. I'm a licensed independent clinical social worker. So I manage the Department of Social Services, as well as I'm a behavioral health provider in which I provide individual therapy for our patients here at MCHD.
Yeah, so Reba and Skandan, you've both been on Wellness Wednesday before, and we've been speaking about this topic and different capacities here and there, but you all are collaborating together, two different departments within MCHD. So let's talk about that collaboration. I know it's in partnership also too with the Mobile County Public School System. So I want to jump right in and give me some details on that collaboration.
Yeah, so I can get started off about how this came to be. So the Health Equity Office, we do surveys asking Mobile County residents what they view is the most important health issue in Mobile County. And the number one response we got is that mental health is the most important issue that is facing them. Yet we know that there are a lot of healthcare disparities around mental health, both in terms of stigma, in terms of access to care, and other factors surrounding your race, your ethnicity, your income, all can contribute to your mental health status. So what we wanted to do is put on a mental health event for the community. And what we're going to do is we're going to be partnering with behavioral health to do a mental health fair and school tour. So in the months of November and December, we are going to be visiting 6 schools in underserved areas of Mobile County. And in the morning, we're going to be doing an education and mental health fair for both kids and parents. And in the afternoon, we're going to be doing a talent show for them.
Reba, let me interject here for a second. You all are focusing on youth. So, Reba, why do you think, is that more disproportionate towards adolescents and that age group, or, or you want to focus specifically there and work your way up or down, or why was that demographic chosen?
That demographic was chosen again, mainly because of what the parents were saying, and then also targeting the schools. Because again, we know COVID has been a tremendous effect regarding the mental health. Just a few numbers. The CDC says that 40% of adults were struggling with mental health issues, such as anxiety and depression, trauma, stress-related, started or increased in substance use, as well as suicide ideation. So we know that when adults are coping with stress, the children see that. And so we wanted to partner with, I'm sorry, I just went blank.
Yes, sir.
We wanted to partner.
There's a lot of different groups. I know it's hard to keep up with them. The biggest group obviously is the Mobile County Public School System, but then you've got some other local DJs and other people that work with other parts of the community. So, and it's okay to have a lot of stuff on your mind. That's a lot of stuff to keep up with. So, yeah, please continue.
I apologize about that. And so, in regards to all of that, we know that we can get the information from the adults, but we also want to hear from the children. And so it's a family, it's a community event. Again, for behavioral health, our mission and our vision is that we're helping our community, we're helping our patients. And so it's just not our patients, but it's their family as well. And
Mhm.
so that's why mental health is partnering, well, behavioral health is partnering in regards to getting the message out about behavioral health.
Yeah, children, they're just a bystander, basically right now. And, they're products of their environment. So, like you both mentioned that, if mom and dad are struggling or another caregiver in the home is struggling, they're going to bring that struggle back to the environment where the kids are. So it's kind of, inescapable. So, it's good that you're getting back to where, you all have already identified, like the health equity office, you all have kind of identified this is where we need to start, which is a good, very, very good baseline for it. So, I think you all are doing some other events in the school. You're doing some kind of, you know, build yourself up type of event. So, Skandan, can you elaborate a little bit on some of those school events?
Yeah, so in addition to the mental health fair, what we really wanted to do was also a talent show. This way we can have the parents also join the kids, and also something for these kids, to display themselves, to be proud of their talents, to, really showcase themselves. And what these 6 schools that we had chosen, these are in underserved areas. So these schools might not always get the best resources, and these kids might not always get the best resources. So we really wanted to bring the resources to these underserved areas and the kids that really need it the most. And also what we're going to be doing with the winners of the talent show is providing them with incentives like gift cards and scholarships. So, that the kids that really put in the work, we recognize that.
That's great. You all are in the, in the right capacity to be able to sow wisdom and knowledge into them at such an early age. And, just like you plant a seed, you sow a seed, it doesn't grow overnight. So, what you're doing is you're setting yourself up, to be successful with this program with kids. And that's remarkable. That's great that you all have identified that. Now, I know you have one date already set of when you're going to start. So, can you provide the details on that?
Yeah, so November 2nd, we're going to be at Williamson, and 9 a.m. to 12 p.m. is when we're doing the mental health education fair part of it. And then from 1 p.m. to 2:30 p.m. is when the talent show is going to happen. And we're also partnering with other, community partners. I know Prism United is on board with what we're doing, and also, the Alabama Department of Mental Health. So we're partnering with other, community partners to have them be part of this mental health fair.
That's great. I mean, it's such a great concept. I mean, we can talk about great programs all day long, but you all are actually doing it. You're out there, you're the boots on the ground, so to speak, and you're in the classrooms and you're in the school systems and in the communities. And that's exactly what we need. Anything else to add about the mental health fair and the opportunities day or anything like that?
Just that, if any programs or any people out there watching want to partner with us, just reach out to us and we'd be happy to make you a part of this event.
Well, thank you for investing in the youth in Mobile County, and please do me a favor and continue to sow that wisdom in Reba. Continue to be a valuable resource of mental health for those seeking. So, let's talk about that real brief before we wrap up. With you being in charge of that program here, we do have counselors and other resources. If someone does need to speak to a counselor, they can call our appointment line at 251-690-8889, and they can reach you or any other counselor, correct?
Correct. And then also we have the new 988, It is also crisis as well as suicide hotline.
That's correct. That is a valuable resource that has been now simplified to a very easy to remember 3-digit number. So, and I just talked to some youth not too long ago at church, and they know 988. They're all very familiar with it. So the word is getting out. So, but thank you both for being on Wellness Wednesday and talking about this community resource that we're just thankful to be a part of.
Thanks for having us.
Thank you so much.
You're welcome.